Today we will be assessing the cardiac and peripheral vascular system. The first thing that I'm going to do is I'm going to go ahead and perform my hand hygiene, and I'm going to come in and introduce myself to the patient. Hello, my name is Carla. I'm going to be performing your heart assessment today.
Okay.
Next, I'm going to go ahead and provide for privacy, and I'm going to identify my two patient identifiers. Can you tell me your name and date of birth?
Sure. Erin Jacob, January 13th, 1990.
Okay, thank you very much. The next thing I'm going to go ahead and do is inspect the general appearance of my patient. I'm going to inspect her skin color and her work of breathing. So I'm expecting her to have skin color that is appropriate with her race. I'm looking for regular relaxed respirations, and I'm looking for skin that is warm and dry. If I'm seeing dyspnea or cyanosis or diaphoresis, that would be concerning, and I would identify interventions and make sure I'm notifying the doctor. The next thing that I'm going to do is assess her anterior chest wall, and I'm making sure that it's rounded and that no retractions are present. The next step is looking for, I'm going to palpate and auscultate the apical pulse. At this time, I'm going to go ahead and have my patient lay back and put their feet up on the bed. Okay. When I'm locating the apical pulse, I am going to count 5 intercostal spaces down, and I'm going to draw an imaginary line from the mid-clavicular area and go down. If you are assessing an apical pulse on a female, and if they have breast tissue that might get in the way, you may need to have them kind of move that breast tissue off to the side. So, Erin, I'm going to go ahead and palpate and listen to your apical pulse.
Okay.
Okay. So I'm going to start by identifying the sternal notch. I apologize, my hands are cold. And then I'm going to palpate along her left side of her sternum for the intercostal spaces. And I'm going to count them as I go down. And once I've gotten to the 5th intercostal space down, I'm going to draw an imaginary line for the midclavicular, and that is where I'm going to go ahead and palpate for the apical pulse. So I'm going to go ahead and feel for that pulse. And then the next step I'm going to do is auscultate. As I'm listening, I am listening for 1 full minute to the apical pulse. I'm listening to make sure it's regular. And once I've listened to it, I want to assess and make sure that I'm listening for any pitching, splitting, any abnormal signs. I want to make sure I've counted the rate in 60 seconds, so normal would be 60 to 100. I also want to make sure that I am using the diaphragm of my stethoscope, which is the larger part right here. So when I'm listening for that, I'm listening for that lub-dub sound. That is the S1, S2 heart sounds. So the closing of the valves create that S1, S2 sound. When you listen and do a cardiac assessment, there are 5 landmarks that you want to identify and listen over. And I use the mnemonic, all patients enjoy taking meds, as a reminder to help me remember the landmarks. So let's go through those now. The 2nd intercostal space on each side of the sternum is the aortic and the pulmonic. Sure, you can go ahead and sit up. So I'm going to go ahead and feel for the aortic landmark, which is second intercostal space, just to her right side of her sternum, and the pulmonic landmark is just on the opposite side, okay? The third intercostal space traveling down the sternum is Erb's point, and then the fourth intercostal space down is the tricuspid landmark, and then the fifth intercostal space down mid-clavicular would be the mitral. That is the point of maximum impulse. So when you hear the tricuspid and the mitral valves closing, you're hearing that S1 sound, that lub sound. When the aortic and the pulmonic valves close, you're hearing that S2 sound, or that dub sound. So that lub dub is what you're listening for. The next thing that you're going to do is I'm going to go ahead and auscultate the carotid arteries for any bruits. When we listen for bruits, we're listening for that swooshing sound. We actually don't want to hear that. That would indicate kind of a turbulent flow of blood through the arteries. Could be a potential concern for narrowing of the carotid arteries. So if you don't mind, I'm going to go ahead and listen to your carotid arteries.
Okay.
For this particular assessment, we're going to use the bell of our stethoscope. And I'm going to have you hold your breath. And then I would listen to this on both sides. So I'm going to go ahead now and listen to the opposite side. Can you hold your breath? So there are no bruits present, so which would be the expected finding for auscultating the carotid bruits. The next thing we want to do is calculate the pulse deficit. The pulse deficit is essentially your apical pulse minus a peripheral pulse such as the radial pulse. You want that to be very minimal to no. All right, the next thing that we're going to do is go ahead and go through and focus on our peripheral vascular system by assessing our pulses. We're going to start with the temporal pulse. As you go through your assessment, you're going to make sure you assess for the pulses on each side, but you never want to do them simultaneously, so one side at a time. So I'm going to start with the temporal pulse. Again, my hands are cold, so I'm going to palpate, and I want to assess for the amplitude of the pulse. We rate pulses between 0 and 4. 0 being no pulse, 1 to 4, 1 being very faint, and 4 being very bounding. Okay. Once I've assessed her pulse, I'm going to go ahead and go around to the opposite side and palpate that. Her pulses I would consider a +2, which would be considered an expected finding. As I move my way down, I'm going to go ahead and assess her carotid pulse on each side. And again, I'm assessing for the amplitude of the pulse. The next thing I'm going to do is assess for the jugular vein for pulsations. Patients who are in fluid overload or congestive heart failure, you may be able to see this jugular pulsation very easily. If you have trouble seeing them in your patient, you can have them lay flat, and it is easier to see that pulsation right around that sternocleidomastoid muscle. One thing that you can do is take a pen light and shine it right in that area, and that may help you visualize. And I can see just a slight, pulsation in her neck. The very next thing I'm going to do is measure her blood pressure. So, Erin, if you could tell me what your normal blood pressure is?
Right around 120 over 80.
120 over 80. So I'm going to go ahead and pump my cuff up about 30 points higher than that. I'm going to go ahead and palpate for the brachial pulse, and that will help me know where, you have a good pulse right there, where to line up my artery marker. I've already measured my cuff, and I know I have the right size. feel the cuff. Give your arm a little hug. Your blood pressure is excellent, 110/60.
Good. That is excellent.
Okay, so the next thing that we're going to do is we're going to go ahead and assess her upper extremities for symmetry. We want to look for her skin color. We want to assess her skin integrity, the skin turgor, and assess her nails. So if you don't mind, I'm going to assess your arms for skin turgor. So I want to make sure that her skin is elastic and there's no tenting. I'm going to assess on this side as well. Good. I see her skin is nice, pink, warm, and dry, appropriate for her race. Next, I'm going to go ahead and have her do the Shamroth assessment with her nails, assessing for any clubbing. So if you could go ahead and put your nails together like this, I'm looking for that little diamond pattern. Very good, thank you. The next thing that I'm going to do is assess her cap refill. So by doing this, we would do this actually both in her fingernails and her toenails. So I'm going to assess her cap refill. Excellent. So we want that within 2 seconds, her cap refill. The next thing that I want to make sure I mention is that when you are assessing for the pulses, you want to make sure that you are counting the rate, how fast it is, and also you're assessing, is it regular, is it irregular, and then taking note of the amplitude. So how you would note that +1, +2, etc. All right, on her upper extremities, the pulses that we're going to focus on are the brachial, the radial, and the ulnar. So when we checked her blood pressure, we had palpated her brachial artery right here. And then we're going to assess her radial, and then the ulnar. Okay? Again, assessing for amplitude on each side. Then I'm going to move over to the other side and do the exact same thing, where I'm going to assess the brachial, her radial, and her ulnar pulse. Okay, and yours all feel good. I would say +2.
Okay.
Good. The next thing that we're going to do is assess lymph nodes in her arms. We're going to assess for the epitrochlear lymph nodes. So I'm going to be assessing, palpating the inner arm, palpating for any possible nodules or nodes. I do not feel anything in your arm. And I would do the same thing on her opposite arm. Palpate, they should not be palpable. The next thing I'm going to do is assess her lower extremities. So I'm going to look at her skin, make sure it looks pink, warm, and dry. There should be hair growth unless it's been shaved off. It would be expected in my patient. I'm also assessing for her overall skin integrity, looking at for any possible potential varicose veins or superficial veins that I might see. All right. The next thing I'm going to do is assess the temperature of her skin. I can assess for skin turgor in her lower extremities. And I also want to make sure I assess the patient for edema. So when I assess for edema, I'm going to go ahead and press and hold and assess for any pitting or markings. And then I would proceed to assess for that in each lower extremity and in each of her feet. Okay? The next thing I'm going to go ahead is assess for her circulation. So I'm going to assess, make sure she doesn't have any numbness or tingling in her lower extremities. So the pulses, we're going to go ahead and we're going to talk about all the pulses in her legs, and we will have you palpate all of those except for the femoral pulse. The femoral pulse is in the groin area. We do want you to know the name of that pulse and where you would locate it. As you work your way down, we have the popliteal pulse, which is below the knee. So we're going to assess for that. And then we have the posterior tibial pulse, which is on the inner ankle. And then the dorsalis pedis pulse, which is on the top of the foot. And we're going to go ahead and palpate those again for rate, amplitude. When you get to the hospital, if you notice you're having trouble palpating those pulses in your patient's feet, you can always use a Doppler to help you find those. Additionally, you want to verbalize in your checkoff that you would assess the inguinal lymph nodes for size, mobility, tenderness, and that also is in the groin area. We are not going to actually have you do that. You will not be palpating that during the checkoff. And finally, the last thing that we will have you verbalize during the checkoff